Thank you for tuning in. If this is your first time, please make sure you subscribe so that you won't miss any of our latest videos. Right, in this lecture, we are going to talk about E. coli. Right, so by the end of this video, you should be able to answer the following questions. Right, we're going to talk about general information about E. coli, virulence factors, the main diseases caused by E. coli, diagnosis, and treatment. Right, the most important part of this video is exam essentials, the part number 6. We are going to have an overview. Right, so I'm not encouraging you to skip and watch the end because I will be summarizing all these things in one slide. Right, so I want you to listen carefully and follow each and every subtopic so that at the end you'll be able to grasp the most important parts of this video. Right, so let's get started. Right, so general information. Right, so E. coli normally resides in the colon without causing any disease. Right, so it's part of normal flora. However, there is an amazing amount of DNA being swapped among the enterics by conjugation with plasmid exchange, lysogenic conversion by temperate bacteriophages, and also direct transposon-mediated DNA insertion. Right, so all these processes will encourage the acquirement of the virulence factors by the E. coli, by the non-pathogenic E. coli. Right, so when the E. coli acquires virulence in this manner, it can cause the disease. Right, so to summarize this whole concept, we have your normal flora here, non-pathogenic E. coli. Right, if it gets the virulence factors, then it causes the disease. Okay, so let's talk about these virulence factors. Right, so the first one is mucosal interaction. Right, how does this bacteria interact with the mucosa? Right, so mucosal adherence with the pili. So the pili is actually a colonization factor. Right, it is a pili, right, to adhere to the mucosa. It's a colonization factor. And also some of the strains have the ability to invade the intestinal epithelial cells. Right, so we will talk more about these strains later. Right, the second point, toxin production. Right, so E. coli produces like two kinds of toxin. Right, first one is the heat labile toxin and the heat stable toxin. Right, L3 and ST, heat stable and heat labile. Right, the next group is Shigella-like toxin. Right, it's more like a Shigella toxin. Right, we'll talk about Shigella later. Right, but this toxin is very important, Shigella-like toxin. Right, this bacteria, like other gram negatives, is an endotoxin. Right, so lipid A portion of the lipopolysaccharide is also a virulent factor here, and it is ion binding siderophore. Right, so this siderophore is a protein which obtains ion from the human transferrin and lactoferrin. Right, so these proteins, they carry ion. Right, so this siderophore from the bacteria will take ion from the proteins carrying ion. Okay, so the diseases caused by E. coli in the presence of virulence factors include the following: diarrhea, urinary tract infection, neonatal meningitis, and gram-negative sepsis. Right, this mainly occur in debilitated, hospitalized patients. So let's discuss these diseases one by one, starting with the diarrhea. Right, so E. coli diarrhea may affect both infants or adults. The infants worldwide are especially susceptible to E. coli diarrhea since they usually have not yet developed immunity. Since water lost in the stool is often not adequately replaced, death from E. coli diarrhea is usually due to dehydration, more like cholera, right? About 5 million of children die yearly from this infection. Adults and children from developed countries traveling to underdeveloped countries are also susceptible to E. coli diarrhea since they have not yet developed immunity during their childhood, right? So this is called traveler's diarrhea, right? So this traveler's diarrhea is also called Montezuma's revenge, right? The severity of E. coli diarrhea depends on which virulence factors the strain of E. coli possesses, right? So there are 4 groups of diarrhea producing E. coli, which I want to talk about, right? But I will tell you in great detail only 3. The 4th one at the end of the video, right? So stay tuned. So let's start with the first one. Number 1 is called enterotoxigenic E. coli or ETEC. This E. coli causes traveler's diarrhea. It is pili, right, as I told you, because this pili is a colonization factor that helps it to bind to the intestinal epithelial cells, where it releases exotoxins that are similar to those on cholera exotoxins, choleragen, right? The toxins are the Hitler biotoxin, which is just like cholera toxin, and the heat stable toxin. These exotoxins inhibit reabsorption of sodium and chloride ions, and they stimulate secretion of chloride and bicarbonate into the intestinal lumen, right? What will happen here is that water will follow the osmotic pull of these ions, resulting in water and electrolyte loss. This produces a severe watery diarrhea with up to 20 liters being lost a day. The stools look like rice water, just like cholera, right? Okay, so that was the first strain, ETEC, enterotoxigenic E. coli. Number 2, we have enterohemorrhagic E. coli or EHEC, right? This E. coli also have a pili for colonization, just like ETEC, but differ in that they secrete a powerful Shiga-like toxin, also known as verotoxin, that is the same mechanism of action as the Shigella toxin. They both inhibit protein synthesis by inhibiting the 60S ribosome, which results in intestinal epithelial cell death. So these bacteria hold onto the intestinal epithelial cells and shoot away like the Shiga-like toxin. The diarrhea is blood, right, because it's hemorrhagic, right? So hemorrhagic. It's accompanied by severe abdominal cramps and is called hemorrhagic colitis. Hemorrhagic colitis, right? So we have another condition called hemolytic uremic syndrome with anemia, thrombocytopenia, that's decreased in platelets, renal failure, that's uremia, and this one is associated with the infection by a strain of EHEC called E. coli O157H7. O157H7, right? It's very important. Numerous outbreaks have occurred secondary to infected hamburgers, meat served at fast food chains, suggesting that cattle may also be a reservoir for EHEC. Right. Number 3, we have enteroinvasive E. coli. Enteroinvasive E. coli. This disease is the same as that caused by Shigella. In fact, the main virulence factor is coded in a plasmid shared by Shigella and E. coli. Right, we have repeated Shigella again and again, so I'm sure next video will be about Shigella, right? Okay, let's continue. This plasmid gives the bacteria the ability to actually invade the epithelial cells, right? Invasive. It gets into the epithelial cells, right? So the enteroinvasive E. coli also produces small amounts of sugar-like toxin. The host tries to get rid of the invading bacteria, and this results in an immune-mediated inflammatory reaction with fever. The white blood cells invade the intestinal wall, and the diarrhea is bloody with white blood cells, just like shigellosis, right? So we talked about how many? 3 so far: ETEC, EHEC, and enteroinvasive. And the fourth one, which I said I will tell you, there isn't much to talk about for now, but at the end of this video, I will tell you what you need to know about this one. It's called enteropathogenic E. coli. Right, so let's conclude this diarrhea caused by E. coli. Right, so look here. You have these 3 bugs. They are holding hands. This is Vibrio cholera, E. coli, and Shigella. Right, so let's talk about the relationship of these 3, and then we'll go to more interesting stuff. Right, so Vibrio cholera, E. coli, and Shigella dysentery are holding hands in this picture, as you can see. The E. coli can cause diarrhea indistinguishable from shigellosis or cholera. Different types of, this is the main picture, right? So this is the main picture. You need to understand this. Different types of diarrhea produced by E. coli and the other enterics are dependent on virulent acquisition from plasmids, and there is active sharing of these vectors, right? So this E. coli can get some virulence from Shigella or even from cholera, right? Okay, so the E. coli diarrhea can just look like cholera, that's rice water stools, or just like shigellosis, that's diarrhea with blood and white blood cells, right? That's all about the first disease, diarrhea, right? Number 2, we have the UTI, right? Urinary tract infections, right? The acquisition of a pili virulence factor allows the E. coli to travel up the urethra and infect the bladder, causing inflammation of the blood, that's cystitis, and sometimes move up to infect the kidney itself, that's pyelonephritis, right? The E. coli is the most common cause of urinary tract infections, which usually occur in women and hospitalized patients with catheters in the urethra. Symptoms include burning on urination, dysuria, having to pee frequently, that's frequency, and a feeling of fullness over the bladder. The culture of greater than 100,000 colonies of bacteria from the urine establishes the diagnosis of urinary tract infection, right? Okay, that's all about UTIs, right? Next, we have neonatal meningitis. E. coli is a common cause of neonatal meningitis, but on number 1, we have group B streptococcus, right? That's Streptococcus agalactiae. So if you hear group B, think baby, right? So actually there are 3, right? We have this one, E. coli, group B, and Listeria monocytogenes, right? So during the first month of life, the neonate is especially susceptible because there is no immunity here, right? So one more time, these three bugs which I just told you: E. coli, group B streptococcus, and Listeria monocytogenes, right? So they infect neonates or babies below the age of 3 months, right? Okay. The next disease is the sepsis, right? So E. coli is also the most common cause of gram-negative sepsis. This usually occurs in debilitated hospitalized patients. Septic shock due to lipid A component of the lipopolysaccharide is usually the cause of death. Right. So these are the four main conditions, right? I also want to mention another one, pneumonia, right? So there is also E. coli causing pneumonia, right? Because E. coli is a common cause of pneumonia in hospitals, right? So it's a common cause of hospital-acquired pneumonia. Right. Another interesting fact, right? So you meet this question in microbiology, right? So this E. coli is an index organism for fecal contamination of water, right? You will see some calculations concerning this E. coli, right? Okay, let's talk about diagnosis of E. coli. Right, so general methods include gram staining because it's a gram negative, right? We can also use culture, right? So on culture, we take specimen from urine samples, sputum, cerebrospinal fluid, if it is meningitis, or even blood, right? This bacteria can grow at 45.5 degrees Celsius. Pathogenic strains may also be isolated from the stools. And E. coli, very important fact, it ferments lactose very fast, right? So its colonies produce green metallic sheen, a green metallic sheen on EMB agar, and a pink purple on McConk agar, right? One more time. This is very important. E. coli, number one, it ferments lactose very fast. It grows on EMB agar, giving a green metallic sheen, and on McConkie agar, giving a pink purple color. Right? Sometimes they can say red. Just be careful. Red or pink purple. Right? Okay. I just want to give you an idea on treatment, right? So the most commonly used antibiotics include cephalosporins, aminoglycosides, trimethoprim, and sulfamethoxazole, fluoroquinolones, right? Now, this is the part we were waiting for, right? An overview, right? So this is very important. Please, you need to pay attention, right? So to sum up everything that we talked about, E. coli, we know it's a gram-negative bacilli, right? Number two, here is indole positive, right? It is an ability to produce indole from tryptophan. The E. coli virulence factors include this fimbriae causing cystitis, pyelonephritis, right? So pyelonephritis, pili. So you can remember it that way. And also it is a capsule, the K antigen. It is a capsule, right? So this will mediate like diseases like pneumonia, neonatal meningitis, and the lipopolysaccharides and the toxin. It leads to septic shock, right? One more time, this fimbriae causes cystitis, pyelonephritis, the capsule, pneumonia, and neonatal meningitis, lipopolysaccharide endotoxin, septic shock. Right, so here we have the strains, the E. coli strains on the second column. we have the toxins and mechanism, and then the clinical presentation, right? So here you have your mnemonics, how you remember each and every one of these strains, right? So let's start with the enteroinvasive E. coli. Enteroinvasive microbes invades intestinal mucosa and causes necrosis and inflammation, right? So you see enteroinvasive, right? EIEC. All right, so you can see I for invasive, right? It causes like dysentery, and the clinical manifestations are similar to those of Shigella. That's enteroinvasive for you. The second one, enterotoxigenic. It produces heat labile and heat stable toxins or enterotoxins. No inflammation or invasion, right? So you can see enterotoxins. And again, it's called what? E-tech. You see this T is for watery traveler's diarrhea, right? Traveler's diarrhea, which is watery, right? E-tech for travelers. Enteroinvasive, it invades like Shigella, right? Okay, on number 3, enteropathogenic, right? We didn't discuss much about this one, but just to remember, no toxins produced. It adheres to the apical surface or like in the intestines. It flattens the villi and prevents absorption, causing malabsorption, right? So it presents usually as diarrhea, usually in children. So for enteropathogenic, there is a P, EPEC. So just to remember, P for pediatrics. So it's usually in children. I think this one is very easy. Enteropathogenic, think pediatrics, children. Simple. And the last one, enterohemorrhagic E. coli or EHEC, right? So I told you about this this strain, right? It's what? 0157H7, right? So this one is the most common serotype in the United States, and often transmitted via undercooked meat, raw leafy vegetables, right? So undercooked meat and raw leafy vegetables, EHEC, right? Sugar toxin, because it is like a sugar toxin, right? So the sugar toxin causes hemolytic uremic syndrome, and this hemolytic uremic syndrome, or HUS, is actually a triad of anemia, thrombocytopenia, and acute kidney injury due to microthrombi formation on the damaged endothelium. This would cause what? Mechanical hemolysis with cystocytes on the peripheral blood cells, platelets consumption, and decreased renal blood flow, right? So this is the pathogenesis, right? So the main points you need to remember about EHEC, right? So it causes what? Dysentery. The toxin alone causes necrosis and inflammation. It does not ferment sorbitol, right? So this will differentiate it from other E. coli, right? It doesn't ferment sorbitol. EHEC, there's an H, so it's associated with hemorrhage, hamburgers, as in undercooked meats, and hemolytic uremic syndrome, right? So EHEC, 3HEC, 3H is hemorrhage, hamburgers, hemolytic uremic syndrome. Thank you so much for believing in us, right? So if you get the opportunity, guys, there's going to be a link in the comment section. If you can donate even $1 on PayPal, I will highly appreciate that. Thank you so much. Thank you for supporting. And the most important thing, please click the subscribe button. Leave a comment in the comment section and share with your friends. Until next time, head bowed.